Today's talk is on advanced care planning. My name is Cathy Lyon and I'm a retired nurse and I'm an End of Life Doula. I was previously the owner-manager of Stanley House Nursing Home, where we had a number of HT patients there. So advanced care planning, and what I'm going to talk to you about today is why an advanced care plan is important, and a little bit about introduce you to a plan to inspire you into thinking more creatively about advanced care planning, what the advanced care planning contains. There are a number of documents that would make a complete and robust advanced care plan, which I think everybody wants. And that one of them is the advanced statement, one of them is the advanced decision to refuse treatment, another is a power of attorney, and then the respect document, which some health authorities are using to help people who go into hospital in an emergency situation. And then at the end, if we have time, I will do a little plan for resilience, because we all need to be resilient throughout our lives and our health journeys. So why is it important to plan? Well, any plan really. If you're planning on going on holiday, or planning on getting your children off to school, or whatever it is, you need to have a plan in order to put you in control of your future planning and put you in control of the outcome of that event. It helps to reduce anxiety, and it can add direction and clarity to our thinking. If you have a plan, you can see where you want to go and you know how you want to get there, then having a plan gives you clarity. Because if you don't have a plan and you're not sure where you're going, you can be vastly underprepared. Or indeed, if you don't tell people what you want, or you don't communicate yourself properly, then you may find yourself uncomfortable in somewhere where you didn't think you were going to be. So I'm going to introduce you to a plan to inspire you. And this is a young man. His name is Sutton. And he was a happy young man. He was doing well at school. And at just 15, he was diagnosed with cancer. He had 2 years of treatment, but the cancer returned. Stephen shelved his plans of going to university because cancer was in the way of those plans that he had. And he was a very inspiring young man, and he decided to create a Facebook page, which was called Stephen's Story. And on that, he posted regularly that he'd been fighting cancerous tumours in his bowel and knee and groin and pelvis, and that he'd had to undergo surgery and radiotherapy and chemotherapy, and all of these things were resulting in him spending a lot of time in hospital. He carried on posting fairly regularly. A medical opinion had ranged from him requiring amputation to it then becoming incurable. And so, inspiringly, he said all he ever wanted to do was study hard and make a difference. So he then decided to be more pragmatic with the time that he had. And so he carried on posting, and this involved utilising as many short-term opportunities as possible to enrich my own life experience. Most importantly, he wanted to try to improve the lives of others by fundraising and raising awareness of cancer in teenagers and young adults. And so he created a bucket list, which I know we're all familiar with. He wanted to skydive, he wanted to write a book, he wanted to crowd surf, and I believe that was in a rubber dinghy at a pop concert. And he wanted to become a film extra, and there were many more things on his bucket list, and I believe that he achieved certainly these and many others. And one of his key plans was to do fundraising. At the time, in a very short time after he made his first post, he'd raised £10,000, and after 12 months of him posting, he'd raised £3 million, which is fantastic. Sadly, he died in May of 2014, aged 19. But 2 years after his death, the total had reached £5 million, and that's a fantastic thing to have achieved. And in November of 2014, Stephen was posthumously awarded the MBE. Now, I think that's an inspirational plan when you're faced with the adversity of end of life. And he had one way of looking at end of life, which is a phenomenal and resilient way of doing so. So, moving on, advanced care planning then is, put simply, is hoping for the best and planning for the worst. And why is it important to have a plan? Well, death and dying are not something that we like to talk about very easily, and we should, because we all know it's going to happen. We all know it's coming. So not talking about it doesn't mean that it's not going to happen. And not talking about it to the person doesn't, to your family or who you love, it doesn't mean that that they aren't going to be upset about it when it happens. It's far better to be creative and talk about it at a time when you can, and when you are able, and when you are clear in your thinking. We plan and prepare for having a baby, and we talk about that when we get excited, and we know exactly what we're going to do, and we know exactly how it's going to be. But we don't do it for end of life, and equally we know that's going to happen, and so we leave it to the last minute, and then surprised it doesn't go well. If you don't tell us what you want, how are we going to know? And so it's no good getting upset and angry at a time when things aren't going your way, because you haven't had the opportunity to tell us what you want at that time, at a better time. And it can help reduce fear and anxiety and frustration. And this is something I know people with HD and their families experience a lot of, and a lot of it comes out of fear and loss of control, and loss of a future vision that you would have once had. So having a plan in place can really help reduce that fear and anxiety, because you can be confident that what you want and what you have shared with people is most likely to be carried out. And it can ease family tensions at an end of life time if people are arguing about what they think should happen or what you think should happen, because you have given clear instructions at an earlier time and everyone was involved in that. And one of the most important things about this is how you die remains in the memory of those who grieve. And so if they know that they did what you wanted, and if you know that they are going to do what you want, then everything is much easier for everybody once you're gone. If you think about Stephen and the chap we talked about earlier, and his mum receiving the MBE on his behalf, that's a wonderful way to leave your legacy in a positive way. So really have a think about that. So what is an advanced care plan? It's a collection of documents, actually, although some people will often just use it as an expression of your wishes. But I would suggest you can put a collection of documents together, which we'll talk through. And they set out your wishes and beliefs and values and preferences regarding your future care. It provides a guide to help the care team around you make decisions if you lose capacity to make them for yourself. It can be changed at any time. It can be completed at any stage of your life as long as you can display capacity. What's covered in an advanced care plan? It's usually your important values and personal preferences for care, understanding what you know about your illness and your prognosis, and helping people to understand where you are in the knowledge of that. Any individual concerns that you might have, you can write them down, and hopefully get those fears out of your head and get those fears dealt with at an earlier stage. Any particular preferences for types of care and treatment that you might have. Obviously, PEG is one of the big issues that we often talk about, and I will talk about that later. Additionally, these documents include practical things, next of kin, where you keep your important documents, so that if and when you were to die, people would be able to find the things that they need to find. Your wishes of before and after death, how you would like to be treated when you were dying, where you would like to be treated when you were dying, your funeral wishes, and what you would like done with your remains. That's quite important. My mother never told me, so at the moment I still have her in the shed, which is, but I kind of think I'll sprinkle her in the garden eventually, but it's something that I've held on to because I'm never really sure what to do, and I wish she'd told me, really. And who you want this information to be shared with, that's an important thing, because it might not be your family. You may have become disconnected from them. It might be a good friend, so make sure that these documents can contain that. Things that someone with HD might like to include, because this condition is very specific and has some quite specific presentations and thoughts that you might have, and so things that make you happy and things that make you sad and things that make you angry, because we know that these sometimes can be very specific, and you may like your routines in such a way, or you might like things placed in such a way, and if someone doesn't know that, then that can cause you stress and anxiety. How I display capacity, how I show I mean yes, and how I show I mean no. And I put this in here because we know that sometimes we can lose our ability to speak, and it's important if you can continue to show a way of yes and no, that will allow you to display capacity even past your ability to speak. What quality of life means to me, and this is really important, and we'll talk about this a little bit more as we move forward, because I can remember a lady that I was looking after her husband, and she said to me, when my husband said to me, when I get as bad as my mother, hit me on the head. And she said, he said that to me, and he was worse than his mother when he said it. So make sure that what your vision is of quality of life can be very clearly assessed by the people that you love. Where would you like to go for respite or long-term care? And I would urge you not to get into those conversations where you say, promise me you won't send me into a nursing home, promise me you won't put me in a home. And then the carers don't get into the conversation of promising that. And I say that because we know that HD can be tricky, and we know that sometimes you're going to need extra support and that your family are going to need extra support. And so asking that, promise me things, puts an extra burden of guilt and grief on somebody if they are unable to provide that for you. So it would be better for you at an earlier stage to acknowledge that you might need long-term support, or you might need respite care, or the person that you love might need extra support in the home, and be open to that, and then take control of that yourself by looking at what homes are available around you, what respite care might look like for you, or what care services can help provide you in the home, and meeting the people that might be able to do that for you. That gives you some control, and it reduces the anxiety, anger and frustration and guilt and grief that can come along with those kind of promises. What treatments you would consider if you were to fall ill with another condition. Again, this goes back to, if you were saying, don't let me go into hospital, don't send me into hospital, that's all well and good, but if you had a broken leg or an appendicitis, you may have to go into hospital and you may have to have treatment. And so we remain open to those kind of circumstances, and the respect form, which we'll talk about at the end, can help a little bit with that. There are other things though, of course. What if you were to develop a leukemia or a cancer that might need chemotherapy or bone marrow transplants? Have an understanding of what that might mean, and would you be prepared to go down that road if and when that came to it? Because just because you have one condition doesn't mean that you can't get another. And so it's important to have those kind of considerations in your mind. And then your thoughts on peg feeding or other kinds of intrusive treatments that HD has particular meaning to, and how you would want to stop this if you would want to. An advance statement then is a statement of your wishes and preferences, but it is not legal and binding, and can be overridden by a medical team if you are unable to display capacity, especially if your safety or your life are considered to be at risk. So an advance statement is just simply about your wishes and your thoughts and your cultural beliefs, etc. And it's a useful guide for those who are involved in your care. Usually includes practical matters such as where you'd like to live and be cared for, do you prefer a bath or a shower, would you like to sleep with the TV on, are you a vegetarian, and what kind of your favourite foods, things that are practical. And if you wanted to be sure that your wishes were adhered to, then you would need to have an advance decision to refuse treatment or a living will. And these must relate to specific medical treatments, and they must specify certain circumstances. So it will come into effect if you've lost capacity to give or refuse consent to treatment, and it will come under scrutiny by a medical team and will be questioned. So anyone who's got one now or is thinking of having one, be prepared to be questioned, and be ready for that by having your advance statements and your advance decisions really robust and really clear, and we'll talk about that clear language in a moment. Valid decisions which are refusals for treatment, they are legally binding, and you need to make sure that they are signed and witnessed. And you don't have to have them prepared or witnessed by anyone medical or by solicitors, but if you really want to be sure, I would suggest that you get somebody with gravitas to witness them for you. So we'll use PEG as an example, because I know that's something that comes up quite often. So here you are enjoying life and you're having some difficulty swallowing. So you decide to have a PEG tube fitted capacitously and with everyone happy that you're going to do that. So you discussed it with your family and you've been very clear that you don't want to be kept alive by being tube fed if your quality of life are diminished to a point that you would consider intolerable. So what you should do, I would, at the same time as having the PEG fitted, prepare an advance decision to refuse treatment document at the same time, because you're just taking control of that situation, and use specific and clear language. When I was preparing this webinar, I spoke to many colleagues about what language you should include, and this is one that they have given me, which is, should the quality of my life become so diminished that I would find it intolerable, then I would like the PEG feeds to cease. And you must include the line, even if my life is at risk. That must be included, because that shows capacitously that you understand that stopping feeding means that that your life will be at risk, and because you will no longer be able to receive diet and nutrition. So be clear about that. To support this decision, you will have need to consider that you have made this decision and completed this document having full capacity to do so. So if you have, it's very important, therefore, that you develop and maintain a way that you can show capacity for as long as you can, and that is simply if you are able to maintain a way of showing yes and no. Then that can take capacity a long way forward, even after the ability to speak clearly. So when I was looking after a lady at Stanley House, she used to fist pump for yes and high five for no, and she did this really clearly. So for quite a long period after she'd lost her speech, she could clearly display capacity, because capacity, I'm sure you will be aware, is to show that you know that this is August and not January, that is 2020 and not 1994. And by saying yes and no, you can do that. You can continue to be able to show capacity quite a long time afterwards. And we have certainly completed a power of attorney for people who have lost their speech but have been able to show capacity. Make sure that you are clear to the people that you love that what your description of what an intolerable diminished quality of life would look like to you. Again, I go back to the gentleman I spoke to about earlier, who said he thought his mother's life was intolerable, but he was still quite far past that when he thought he was still okay. So I just dotted a few things down here from the people that I've looked after over many years. So that might be that you are in bed all the time and you can't get out of bed any longer, that you cannot display joy or delight by smiling or laughing or in any other way, that you are having repeated infections. And this goes back to a situation that we know is where the trajectory of your health is diminishing. So if you're getting repeated infections that aren't recovering, it does mean that you're coming to an end of life naturally anyway. Or that you cannot maintain eye contact. And I put that in there too, because a lot of patients that I've looked after are still able to look me in the eye and still able to acknowledge what I'm saying to them. So maybe if you weren't able to do that any longer, your family or loved ones may realise that this is a time where you think that your quality of life is diminished. You can communicate all of this stuff in an advance statement that isn't legally binding, and you can communicate it in an advanced decision to refuse treatment, which is legally binding. If you want to make sure that it's really tight and you're really clear on this, then you should consider lasting power of attorney. And a lasting power of attorney was created by the Mental Capacity Act in 2005 to help people who wanted to make some of these decisions that we have to make, and so that the families aren't struggling with anxiety and frustration about that not being adhered to. These things are in place to help that happen so that we can speak on someone else's behalf. So anyone who has capacity to do so can choose a person, an attorney, to make decisions on their behalf if they subsequently lose capacity to display capacity. Sorry, and this is where getting your husband or wife or loved one or friend to act on your behalf when you cannot speak for yourself, and that's important that they know what your wishes are. So it's important to have an advanced care plan decision so that everyone knows what you want. A lasting power of attorney must be arranged and be registered with the public guardian office whilst you still have capacity. So that must be done in advance of any deterioration. You can prepare one yourself, actually. You can download them off of the government website, or you can employ a solicitor to do this. There are two types, financial and health and welfare, and they cost £82. Currently, they cost £82 to register an LPA, so it would be £164 for both. If you choose to use a solicitor to help you prepare one, then there will be added costs on top of that. Lasting power of attorney. The Office of Public Guardian supports and promotes decisions for those who wish to plan for the future, and this website will help you understand what some of these decisions are. You need to be able to show capacity. I keep on going on about this, but make sure that you start practicing or being confident and comfortable in the way that you show capacity. And it can't be that your husband or wife understands how you show it. You have to be able to show it to other people. So make sure that that is very clear, that you have made your language clear, that you again, I'll go over that should your quality of life become diminished, that you would like your PEG fees to cease even if your life was at risk. Make sure that is very clear, and make sure that you're clear in what diminished quality of life means to you. Make sure everyone understands that, and that is logged in your power of attorney document. The importance of lawyering up. Now, when I was planning for the webinar, I spoke to some of my colleagues on the HDA and on the Executive Council, and quite a few of them use this term, lawyering up. I think because we all know and have come across lots of people who have had challenges in their advanced decisions, and so getting a solicitor involved in your decisions you're making while capacitous is really important. And here I wanted to share with you an email that Ruth had received and that she shared with me from a gentleman who had got a PEG in situ, his wife got a PEG in situ, and he had had challenges with that. Let me just share that with you now. So my wife and I were both having a good time together, and we decided it would be good to continue that, and getting a PEG feed would be positive for our time together. She was absolutely adamant that she did not want to go past the point where her quality of life was too low, and she repeatedly insisted that I must draw the line when that point came. This I repeatedly vowed to do. She very much knew that she could trust me, but we did not write a living will. And my plan was to stop the feed when the time came. I believed I could do this in my own house and that any humane doctor would consent, but the law said otherwise, and it was impossible to stop the feed. We were not warned before the PEG feed was fitted, and she went on for 7 years longer than she would have ever wanted to. So this is a cautionary tale. They had gone into PEG and they had those decisions, but even then it wasn't good enough. So make sure that you have your intentions very tightly bound within legal speaking and within a legal framework. The other thing, again, I will caution you here, is that she repeatedly insisted he draw the line, and he repeatedly vowed to do so. And I go back to that comment I made earlier about not asking and getting people to promise things that maybe they cannot achieve, because I'm sure this gentleman still struggles with that, with the grief of that and the regret of that, which is an unfair and extra burden to place on anybody that is going through this grief process. So the importance of lawyering up can be prohibitive, of course, because there is a cost. You can apply for fee exemptions though, and there are details of these on the website. So like legal aid used to be, you can apply for that. They would be means tested, but you can get support to make sure these things are done. You can get help and advice on filling out forms from the HDA or the HDA advisor, but you might want to consider employing the service of an End of Life Doula, and I've added the website that I'm involved with there. Doulas can help you with decision making, or help you to frame your decision making, but help you certainly with form filling and any concerns you have about end of life. The respect form is another one of the documents that could come together to create a robust advanced care plan, and looks like this, and they're not being used nationally, so check with your GP to be sure that it's being used in your area. And what the respect form does is give guidance for your preferred clinical care in an emergency. This goes back to when I was talking about if you broke your leg or had an appendicitis or whatever. And it kind of just talks about your medical history, what's wrong with you already, HD then, and anything that you might like to include. It isn't legally binding, however, and the medical team could override it. I do know of a gentleman who went into hospital because he fell and had fractured his collarbone, and he was in hospital for a very long time. It was a lot of complications, and he lost his ability to swallow whilst in hospital, and they put a peg in, and he wouldn't have wanted that, but they did, and then he survived a long time after that. So it could include withdrawal and nutritional support if you had a PEG, or it could include not wanting to have a PEG, but the language used must be clear and specific, and they still may override it. It still can be overridden. And so it's best to have this form as part of a complete advanced care plan. So that's advanced care planning is quite dry and lots of information there, and there are lots of ways that you can find out about it. The message that I wanted to share with you was make sure that you are clear and make sure that you are specific in your language, and make sure that you start talking about it now so that you have a bit of control over your future and the way that it goes. I just want to put a little bit about resilience here, the resilience thinking, and how care planning is part of resilience thinking. So this is the Penn Institute diagram. It's palm of a hand, obviously. It's a Penn Institute diagram, and what they say is, here you are facing an adverse situation. Here is your adversity, and this is the thumb is the best case scenario, and the little finger is the worst case scenario. And if your adverse thinking only has you thinking about these two scenarios, then it can become complicated and stressful and anxious. So if you're only focusing on your worst case scenario, I have HD and it will kill me. That's one thing that we worry about. Or your best case scenario, which is I wish I didn't have HD, or when will the cure come? If you're only focusing on those two things, you're missing opportunities to think of other ways of living your life today, because you've got one foot in the past, wishing it didn't happen, and one foot in the future, worrying about how your life is going to end. But there's lots of opportunity in the middle to maintain a positive quality of life. And I want to share with you now just a little Facebook post that I saw the other day from one of our HD community, Matt Ward, and I have spoken to him, and he said it was okay that I share it, just to show you a little bit about how you can nudge things forward with resilience. So he posted, today's depression has been like a black vice crushing my heart and soul. It takes the most of the day to battle my way out of bed, and I managed to empower myself through it by telling my demon that I know its name, HD, and that that it was not welcome in my mind. It said, I'll kill you, and I said, not today. And that little line there is a resilience thinker. Yes, we have this situation of adversity, and I do understand it is really, really tough. But if you can just nudge it forward, then you can improve your quality of life a little bit each time, a little bit each day. So here you are with your worst case scenario, I'm going to die, and there's your best case scenario, I wish I didn't have it, and let's hope for the cure. And absolutely, let's hope for the cure. That's your best case scenario right there. However, another thought might be, not today. What can I do today? And I think Matt went off kickboxing, and he just lifted his day, and he lifted his thinking out of this darker place, because living in that dark place continually day to day is not good for any of you. And it's really important to try and nudge things forward. A better way to think of things could be taking control, an advanced care plan, and then what next? Okay, I've kickboxed today, what can I do tomorrow? What can I do next week? And so on. And then an even better way, of course, could be to plan to inspire. And we look at something like Stephen's story and how that can be included in your experience of HD and your resilience in thinking. And I know at the conference last year there was that that wonderful, inspiring young man who was traveling and was raising money. And there are lots of ways that we can take this terrible adverse situation and make it more positive, because remember that how you die and how you experience this trajectory will be left in the minds of those who you love behind you, and how they will grieve. And how comfortable that is for everybody moving forward. So a resilient thinker would say, what do I want to do? What do I want to feel? And how I want to think tomorrow? Those questions. So Matt went off kickboxing, and maybe he'll do that the next day to keep his thinking out of the worst case scenario. How do you want to feel next week? Feel and think next week. How do you want to feel and think and do next month? And how do you want to feel and do and think in 6 months' time? Or what do you want to do in 12 months' time? And keep your mind out of worrying about your end of life and the past, because your quality of life needs to be focused on now as well. Yes, take control with an advanced care plan, but also take control of each day by keeping a plan in place for resilience, because your quality of life needs to be now. Okay, so a robust care plan for me would be having a resilience plan to get a little folder together and having a resilience plan, an A4 sheet of what you want to do tomorrow, next week, 6 months, 12 months, and get those things in there. Having those kind of things in place will help you revisit the care plan, which you will need to do to look at all the other documents. But the first thing I would have is a resilience plan in there. Then your advance statement, which is what, where, when, who and how you want these things done. That's just an expression of your wishes. And if that's all you want to do, that's fine. You can get official documents that are advance statements, and you can lodge those with your GP, and they can, and it will help them to know what you want and when you want. But it isn't legal and binding. So if you've got any specific wishes, you will need to have your advance decision to refuse treatment. And in that you will put, I do not want this to happen, even if my life is at risk, my quality of life is poor. It's legally binding and it's signed and witnessed, and that will make sure that your future wishes are adhered to as far as it can be. Lasting power of attorney document could be in this folder. I've got lasting power of attorney for my dad and for my mother-in-law and my father-in-law, and I've got them all knowing, so I know exactly where they are. They're for finance, health and well-being, who can do this, so who you want to do this, and when they can do it, and make sure that it's clear and it is legally binding. And I go back to the resilience plan, and having something like that in place that you need to keep revisiting and need to keep thinking about, to keep you positive, to keep you feeling that you're moving forward, because then it will make sure that you have checked these documents too, that they're relevant, that the people that you want to do it are still the people that you want to do it, that the message that you want to send is still the message that you want to send. The respect document, if you're using that in your area to use in an emergency, but the respect document and the information in the respect document can be in the advance statement. Again, the advance statement is not legally binding though, but that can be all that you need or want to have in your advanced care plan. These others are the legal and binding ones that will keep you safer. And then if it was me, in the folder, I would have my will and any insurance policies, just so that as things move forward and as you maybe lose the ability to communicate, your people who love you know where to find those things. Okay. And then that's it really. I'll just end on a little bit of philosophy. So Nietzsche says, any man who has a why to live can bear almost any how. And I think that is a good way of thinking about it. So thank you for your time. Here are some websites that you can look at that will give you further information. But I hope what I've shared with you today has given you some food for thought.